This is a short video about women's sexual health, how to evaluate it in the ambulatory setting, and resources available for you and your patients. Don't worry about taking notes, I'll get you the link later. So let's get started. Sexual health is a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. The topic of sexual health is important to patients. To get started, let's look at a few statistics. When polled, over 50% of patients expected their clinician to ask them about their sexual health, and 68% of them wanted a provider who seemed comfortable with the topic. When surveyed, 89% of physicians felt that the topic of sexual health was somewhat or very important. Yet, only 22% of them always evaluated their patient's sexual health, and 23% of them never even asked. And in another survey, 69% of physicians underestimated their patients' sexual concerns. It's estimated that a staggering 4 out of 10 women will suffer from sexual dysfunction at some point in their life. Given the variety and high prevalence of sexual dysfunction, we know that there's a large number of women that are not having their concerns addressed. Since we know that there's a high prevalence of sexual dysfunction, and clinicians think it's important to evaluate sexual health, and patients want and expect us to ask them about it, then why are we not asking patients about their sexual health? When physicians were surveyed, the number one reason that they gave was that they don't have time. Other reasons that they gave were a lack of training and a lack of knowledge of known treatment options. Well, prepare to be enlightened. This next section of the video will review how to ask your patients about their sexual health, how to address your patients' questions or concerns, what different clinicians such as sexual health specialists, physical therapists, and sexuality mental health professionals do and how to refer to them, and where to find additional resources like helpful websites, organizations, and continuing education opportunities. This next section is how to ask and evaluate. The first thing to do is to set the stage. You can say things like, I'm going to ask you a few questions about your sexual health and sexual practices. I ask these questions of all of my patients. I understand that these questions are personal, they're important for your overall health, and your answers will be kept confidential. The CDC has put out guidelines on how to take a sexual health history with the 5 Ps. This includes partners, practices, protection, past STIs, and pregnancy prevention. The 5 Ps are very important and helpful in a sexual health evaluation. But there's 2 Ps that they're missing: pain and pleasure. How can you ask these questions? It's simple. Just ask. Do you experience any pain with penetration? Do you enjoy intimacy? How is your desire, libido, arousal, and orgasm? Or simply ask, do you have any sexual health concerns or questions today? You can even screen patients before they get into the exam room with questionnaires. The Female Sexual Function Index, FSFI, is a questionnaire made up of 19 questions that evaluate 6 domains: desire, arousal, lubrication, orgasm, satisfaction, and pain. It's great because you can use it for a whole sexual function evaluation or use it to evaluate each domain individually. The Female Sexual Distress Scale, FSDS, is a questionnaire that's made up of 20 questions and is used to evaluate how distressed your patients are about their sexual function. The FSDS-R is a revised scale that is made up of 13 questions and is found to be just as good at screening. So the big question is, what do you do if you feel like you've opened up Pandora's box, but you don't have the time or the training to evaluate your patient's concerns? What do you say to your patient? There's a simple formula you can use with all sensitive topics. The first thing to do is to thank your patient for sharing the information. You can say something like, "Thank you for telling me that," or "I'm glad you told me that." Next, acknowledge the importance of the topic. You can say something like, "I know many women who have the same concerns or questions," or "This topic is important," or "Your sexual health is important." Lastly, create a plan for follow-up. If you feel comfortable evaluating your patient's sexual health concerns, you could say, "This deserves more time. I'd like you to come back for another appointment so we can give this the attention it deserves." If you don't feel comfortable or feel like you'll never have the time, say something like, "I'd like to get you an appointment to see a specialist to address your concerns." Or if you've got a great referral network, which we'll get into in a minute, you could say, "I'd like you to see so-and-so. They're an expert and should be able to address your concerns." Remember that patients want a provider who seems comfortable, so use the formula and put it in your own words. Here's some examples. "I'm so glad you told me that. Your sexual health is important and this topic deserves more time than we have today. So let's get you an appointment next week so we can give it the time it deserves." Or you could say, "Thank you for entrusting me with that. I know many women who have the same concerns that you do. I want to get you the best care, so I'd like you to see so-and-so. They're an expert in this field." Next, we'll review what your referral sources do and where to find them. Possible referrals include sexual health specialist, sex therapist, and pelvic floor physical therapist. Sexual health specialists are also known as sexual medicine specialists. They are licensed clinicians that have additional training in sexual medicine. They're physicians, nurse practitioners, physician's assistants, and certified nurse midwives. They can evaluate patients' concerns, order labs, prescribe medications, and provide referrals. It's important to know that not every OB/GYN medical provider is trained in sexual medicine, so it's important to refer to those who have a specialization in the topic. So where can you find a sexual health specialist? You can start by networking in your community. Find those who've taken an interest in sexual medicine in your local area. You could get names from fellow clinicians who send out referrals, and you can ask patients who've been treated. The International Society for the Study of Women's Sexual Health maintains a list on their website of clinicians who specialize in sexual medicine. The International Pelvic Pain Society also maintains a list, as does the American Association of Sexuality Educators, Counselors, and Therapists, who may have medical clinicians that are members of the association. Another helpful list of medical providers is on the webpage of the National Vulvodynia Association. The next group of referrals are pelvic floor physical therapists. Physical therapists are highly educated, licensed healthcare professionals who diagnose and treat individuals and can help patients reduce pain and improve or restore mobility. Physical therapists can teach patients how to prevent or manage their condition so they will achieve long-term health benefits. Pelvic floor physical therapists have the same education and training as a physical therapist. They usually have a bachelor's, master's, or doctor's degree, and at this time, the entry level is a clinical doctorate. They focus on pelvic floor evaluation and treatment while utilizing external and internal work to achieve this. The WCS, Women Certified Specialist, is a certification offered through the American Physical Therapy Association after passing an exam. Pelvic floor physical therapists do not need this to practice, but it could be a jumping off point to find a pelvic floor PT. Find somebody who has experience and who's competent. So where do you find a pelvic floor physical therapist? The American Board of Physical Therapy Specialists, the American Physical Therapy Association, the section on women's health and of the American Physical Therapy Association, the International Pelvic Pain Society, the International Society for the Study of Women's Sexual Health, and as always, networking in your community. Another referral is to the sex educator, counselor, or therapist. Sex educators, counselors, and therapists focus on the mental health aspects of sexuality. Educators teach and train about a range of topics. Counselors represent a variety of professions focusing on immediate concerns of the patient, and therapists are licensed mental health professionals that provide comprehensive and intensive psychotherapy. The American Association of Sexuality Educators, Counselors, and Therapists are certifications that are given after didactic work and supervision hours have been completed. Similar to pelvic floor physical therapists, the certification is not required for practice, but you can find somebody who has experience and who's competent. There are also clinical sexologists who have a PhD in clinical sexology, and a sex coach, which is like a life coach who focuses on sexuality. So where can you find mental health professionals who specialize in sexual health? The American Association of Sexuality Educators, Counselors, and Therapists, the American Academy of Clinical Sexologists, the American College of Sexologists, the World Association of Sex Coaches, and the Psychology Today website, which is a listserv that professionals can pay to be a part of. Now on to helpful organizations and continuing education opportunities. The The International Society for the Study of Women's Sexual Health, ISSWSH, is a multidisciplinary academic and scientific organization with the following purpose: to provide opportunities for communication among scholars, researchers, and practitioners about women's sexual function and sexual experiences, to support the highest standards of ethics and professionalism in research, education, and clinical practice in women's sexuality, and to provide the public with accurate information about women's sexuality and sexual health. They have an annual conference, a fall course, and an ISSWSH Fellow designation, which signifies training in the interdisciplinary collaborative management of female sexual health within clinical or research tracks. The International Pelvic Pain Society, IPPS, has a mission to serve as an educational resource for healthcare professionals, to optimize diagnosis and treatment of patients suffering from chronic pelvic pain, to collaborate on research in pelvic pain, and informed men and women to serve as a resource of education for treatment options and professional healthcare members. They have an annual conference and a clinical foundations pre-conference workshop. The International Society for the Study of Vulvovaginal Disease has a mission to promote international communication among gynecologists, pathologists, dermatologists, and related disciplines, and to establish international agreement on terminology and definitions of vulvovaginal disease, and to promote clinical investigations, basic research, and dissemination of knowledge in this field. They have a World Congress and a postgraduate course. The American Association of Sexuality Educators, Counselors, and Therapists, ASECT, is a not-for-profit interdisciplinary professional organization. These individuals share an interest in promoting understanding of human sexuality and healthy sexual behavior. They have an annual conference and multiple educational seminars. The Northern American Menopause Society, NAMS, is a multidisciplinary society that is dedicated to promoting the health and quality of all women during midlife and beyond through an understanding of menopause and healthy aging. They have an annual conference and a NAMS certification. Here's some pelvic floor educational opportunities. The American Physical Therapy Association section on women's health has a Level 1 3-day course. Herman & Wallace has courses for medical professionals seeking to improve their practice skills for treatment of pelvic floor and girdle dysfunction and numerous other conditions affecting patients' lives. They also have a practice directory. The Pelvic Guru Academy has multiple courses and trainings for basics and beyond about the pelvic floor. Other resources include websites like the National Vulvodynia Association, the Pelvic Guru, Our Bodies, Our Blog, badvibes.org, ISSWSH, NAMS, IPPS, and ASECT. Journals include the Journal of Sexual Medicine, the International Urogynecology Journal on Pelvic Floor Dysfunction, Menopause, and the Journal of Sex and Marital Therapy. So now you know how to ask your patients about their sexual health, referral options, and resources. So let's summarize. Sexual health is important to patients. Patients want and expect their providers to ask them about their sexual health. There's a high prevalence of this sexual dysfunction, and there is something you can do about it, if you ask. When evaluating patients, normalize the question, thank them for their answers and trust in you, acknowledge that their sexual health is important, and don't be afraid to not address their concerns that day. Schedule a follow-up and refer as needed. The best way to approach treating sexual dysfunction is with a multidisciplinary team that includes a medical provider, a mental health provider, and a pelvic floor physical therapist, and most important, the patient. Now that you know that you have different types of referral sources and also how to find them to create those connections in your community, and websites, organizations, and resources, and you know how to ask about sexual health and address your patients' questions or concerns, just think of the difference that you're going to make for women. For more information, references, and a resource list, visit sexhealthwellness.com.